Antibiotics have revolutionized modern medicine, saving countless lives from bacterial infections. However, their use and misuse vary greatly across different cultures and countries. In this video, we'll explore how cultural beliefs, traditions, and healthcare systems influence antibiotic use around the world. Understanding these differences is crucial for promoting responsible antibiotic practices and combating the growing threat of antibiotic resistance. Let's begin by looking at why cultural perspectives matter when it comes to antibiotics. Culture shapes how people perceive illness, treatment, and medicine. In some societies, antibiotics are seen as a cure-all, while in others, there is more caution about their use. These cultural attitudes can affect how often antibiotics are prescribed, how patients use them, and whether they complete their courses. By understanding these cultural influences, healthcare providers can better communicate with patients and encourage responsible antibiotic use. Antibiotic resistance is a global health crisis. When antibiotics are overused or misused, bacteria can become resistant, making infections harder to treat. This problem is not limited to one country or region, it affects everyone. Cultural differences in antibiotic use contribute to this issue, so addressing these differences is essential for global health. Some countries, antibiotics are available over the counter without a prescription, while in others, strict regulations control their use. Easy access can lead to misuse, such as taking antibiotics for viral infections or not completing the full course. On the other hand, limited access can result in untreated infections. Balancing access and regulation is a challenge influenced by cultural and systemic factors. Many cultures have strong traditions of using herbal remedies or other forms of traditional medicine. These beliefs can influence how people view antibiotics. In some cases, antibiotics may be seen as unnecessary or even harmful, while in others, they may be preferred over traditional treatments. Understanding these perspectives helps healthcare providers offer more culturally sensitive care. Doctors, nurses, and pharmacists play a key role in guiding antibiotic use. Their own cultural backgrounds and training can influence how they prescribe antibiotics. In some cultures, there is pressure to satisfy patient expectations, leading to unnecessary prescriptions. Training healthcare providers to recognize and address cultural differences is essential for promoting responsible antibiotic use. In some cultures, patients expect to receive antibiotics for common illnesses like colds or flu, even when they are not needed. This expectation can put pressure on healthcare providers to prescribe antibiotics unnecessarily. Educating patients about when antibiotics are appropriate is a key step in changing these expectations and reducing misuse. Language differences can make it difficult for patients and healthcare providers to communicate effectively about antibiotics. Misunderstandings can lead to incorrect use, such as taking the wrong dose or stopping treatment early. Providing information in multiple languages and using interpreters can help bridge these gaps. Health literacy refers to how well people understand health information and services. In some cultures, low health literacy can lead to confusion about when and how to use antibiotics. Improving health literacy through education and clear communication is vital for promoting responsible antibiotic use. Trust in healthcare providers and systems varies across cultures. In some places, people may distrust doctors or government health advice, leading them to seek antibiotics from unofficial sources. Building trust through transparency, respect, and culturally sensitive care can encourage people to follow medical advice about antibiotics. Economic conditions can influence antibiotic use. In low-income areas, people may share antibiotics or save leftover pills for future use, which can contribute to resistance. In wealthier regions, overuse may be driven by convenience or access. Addressing economic barriers is an important part of promoting appropriate antibiotic use. Government regulations play a major role in controlling antibiotic use. Some countries have strict prescription laws while others have more relaxed policies. Effective policies must consider cultural attitudes and local practices to be successful. Collaboration between governments, healthcare providers, and communities is key. In some regions, pharmaceutical companies aggressively market antibiotics to both doctors and the public. This can lead to increased demand and overuse. Understanding the impact of marketing and regulating advertising can help reduce unnecessary antibiotic use. Pharmacies are often the first point of contact for people seeking antibiotics. In some cultures, pharmacists may dispense antibiotics without a prescription. Training pharmacists to educate customers and enforce regulations is an important step in addressing misuse. Community norms and beliefs strongly influence health behaviors, including antibiotic use. In some places, community leaders or elders may advise on treatment, shaping how antibiotics are used. Engaging communities in education and awareness campaigns can help shift attitudes toward responsible use. Family members often share advice and experiences about antibiotics. In some cultures, it's common to use leftover antibiotics from a relative or friend. Encouraging families to seek professional advice and avoid sharing medication is important for preventing misuse. Religious beliefs can shape attitudes toward medicine, including antibiotics. Some faiths encourage natural healing or prayer over pharmaceuticals, while others support modern medicine. Respecting religious perspectives and working with faith leaders can help promote responsible antibiotic use. Antibiotic use can differ between urban and rural areas. In cities, access to healthcare and information is often better, while rural areas may rely more on self-medication or traditional remedies. Tailoring education and resources to local contexts is essential for effective interventions. Public education campaigns can raise awareness about the dangers of antibiotic misuse. Successful campaigns often use culturally relevant messages and local languages to reach diverse audiences. Involving community leaders and using multiple media channels can increase impact. Teaching children and young people about antibiotics in schools can help shape future attitudes and behaviors. School-based programs that include interactive lessons and parental involvement are especially effective in promoting responsible antibiotic use. Television, radio, and social media can shape public perceptions of antibiotics. In some cultures, media campaigns have successfully reduced misuse by providing clear, accurate information. Monitoring and guiding media messages is important for supporting responsible use. Social media platforms can spread both helpful and harmful information about antibiotics. Misinformation can lead to misuse, while positive campaigns can encourage responsible behavior. Engaging influencers and monitoring trends can help promote accurate information. Workplaces can influence antibiotic use by setting policies for sick leave and health benefits. In some cultures, employees may feel pressured to return to work quickly, leading to misuse of antibiotics. Supportive workplace policies can help employees recover fully and use antibiotics appropriately. Migrants often bring their cultural beliefs and practices about antibiotics with them. Healthcare providers need to be aware of these differences and offer culturally sensitive advice. Providing information in multiple languages and respecting diverse perspectives can improve care. International travel can spread antibiotic-resistant bacteria and expose people to different prescribing practices. Travelers may purchase antibiotics abroad or bring them home, sometimes without proper guidance. Educating travelers about responsible use is important for global health. Antibiotics are also used in animals, and cultural attitudes toward veterinary medicine can affect human health. In some countries, antibiotics are widely used in livestock, contributing to resistance. Addressing cultural practices in animal husbandry is part of the solution. In some cultures, antibiotics are used in food production to promote growth or prevent disease in animals. This can lead to antibiotic residues in food and contribute to resistance. Raising awareness about food safety and promoting responsible practices are important steps. Organizations like the World Health Organization work to address antibiotic resistance worldwide. They develop guidelines, support research, and promote international cooperation. Adapting global strategies to local cultures is essential for success. Tackling antibiotic resistance requires collaboration between countries, cultures, and sectors. Sharing knowledge, resources, and best practices can help address cultural differences and promote responsible use. International partnerships are key to making progress. Sweden is known for its strict antibiotic policies and low rates of resistance. Cultural attitudes favor caution and trust in healthcare providers. Public education and strong regulations have helped Sweden become a model for responsible antibiotic use. In India, antibiotics are widely available and often used without prescriptions. Cultural beliefs, economic factors, and limited regulation contribute to high rates of misuse. Efforts to improve education and strengthen policies are ongoing to address these challenges. In the United States, antibiotic use is influenced by patient expectations, healthcare access, and pharmaceutical marketing. While regulations exist, overprescribing remains a concern. Ongoing education and stewardship programs aim to reduce misuse and resistance. China faces challenges with antibiotic overuse due to cultural beliefs, economic incentives, and limited regulation in some areas. Efforts to educate both healthcare providers and the public are underway, with a focus on changing attitudes and improving practices. In Nigeria, antibiotics are often purchased without prescriptions, and self-medication is common. Cultural beliefs and limited access to healthcare contribute to these practices. Community education and stronger regulations are needed to address misuse. Brazil has made progress in regulating antibiotic sales, but cultural attitudes and economic factors still influence use. Public campaigns and improved access to healthcare are helping to promote responsible practices. Japan has relatively low antibiotic use, partly due to cultural attitudes that favor caution and trust in medical advice. Strict regulations and public education have contributed to responsible use and low resistance rates. In Egypt, antibiotics are often used without prescriptions, and cultural beliefs support self-medication. Efforts to educate the public and enforce regulations are ongoing, with a focus on changing attitudes and improving access to healthcare. Australia has implemented strong antibiotic stewardship programs and public education campaigns. Cultural attitudes support responsible use and regulations are strictly enforced. These efforts have helped reduce misuse and resistance. In Russia, antibiotics are sometimes available without prescriptions and self-medication is common. Cultural beliefs and economic factors influence use. Recent efforts focus on improving regulation and public education to address misuse. South Africa faces challenges with antibiotic misuse due to cultural beliefs, economic barriers, and limited access to healthcare. Community education and improved regulations are key strategies for promoting responsible use. In Mexico, antibiotics are sometimes sold without prescriptions and self-medication is common. Cultural attitudes and economic factors play a role. Recent policy changes and public education campaigns aim to reduce misuse. The United Kingdom has implemented strict regulations and public education campaigns to promote responsible antibiotic use. Cultural attitudes support trust in healthcare providers, and stewardship programs have helped reduce resistance rates. Examining different countries reveals that cultural beliefs, economic factors, and government policies all play a role in antibiotic use. Successful strategies combine education, regulation, and community engagement. Learning from global examples can help shape effective interventions everywhere. Addressing cultural differences in antibiotic use requires ongoing effort from governments, healthcare providers, and communities. By respecting diverse perspectives and promoting responsible practices, we can protect the effectiveness of antibiotics for future generations. Cultural differences in antibiotic use present both challenges and opportunities. By understanding and addressing these differences, we can work together to combat antibiotic resistance and ensure that these life-saving medicines remain effective. Thank you for joining us on this important journey toward global health.